So good morning. Welcome to the Doctors Across New York Physician Loan Repayment and Physician Practice Support Programs webinar. Thank you for joining us today. My name is Carolyn, and I'm going to walk you through some of the specifics for the grant, hopefully answering all your questions and emphasizing key points that you'll need to know as you move forward to apply for this grant. Hopefully by now you've all had the opportunity to read the RFA in the Gateway. Many of you may have also registered for your Grants Gateway account. If you've not done that yet, don't worry, it's not too late. We just gave you the heads up to get started a little bit early. As Jeff mentioned, if you have questions throughout the presentation, please feel free to type them in. We will try to address them at that given time, and if not, we will circle back at the end of the presentation and address any outstanding items. So moving into the program background, well, just a few quick blurbs on what we're all about. The New York State Doctors Across New York initiative includes several programs collectively designed to help train and place physicians in underserved communities. That's a key phrase that we will define later on. There's many questions about what an underserved community is. The DANY programs make funds available to help recruit and retain physicians to work in these medically underserved areas of the state. Funding is provided in exchange for a physician's commitment to work in an underserved area for a 3-year period. That's also referred to the DANY service obligation period. This slide summarizes the key dates that you're going to want to be aware of throughout this process. First and foremost, you can submit questions in writing to our DANY 2018 email inbox. All those questions should be received by May 2nd, so you have plenty of time to digest the webinar, read through the RFA, and send us your questions. We do ask that you do so in writing. The questions and all the answers to the questions will be posted in the Gateway on May 9th, and that is so that everyone gets a chance to read everything at the same time and all information is shared. The application itself, you're not able to submit anything until May 16th. That is when the status of the grant will change from a non-gateway opportunity to a gateway opportunity. So please be aware that you can read the application, start preparing your documents, but nothing can be uploaded until May 16th. From that point on, you have until June 13th at 4 o'clock to submit your application. And it is important for you to remember that at 4 o'clock, that gateway will close. So if you try to submit something at 4:01 or 4:02, you will not be successful, and we are not able to accept any late admissions. Program-specific questions should be directed to the department, and again, here is our email address where you can submit those questions directly to us. After the May 2nd deadline, we can only answer technical questions. So again, program questions up until May 2nd, technical questions thereafter. And by technical, we mean if you have a problem getting into your Gateway account, uploading a document, something specifically related to the Gateway itself, we can always answer those questions right up until the due date of the grant. And again, the help desk is always going to be available throughout the process. So the biggest question is who may apply. Two types of applications can be received. The first from an individual physician, and the second from a healthcare facility. So if you're a healthcare facility, we can accept an application from a general hospital, DNTC, or nursing home licensed by the department. You can be a facility certified but not operated by the Office of Mental Health. You can be a facility licensed but not operated by the Office of Alcoholism and Substance Abuse. Or you can be a medical practice registered in New York State as a PC or PLLC. Again, this is a frequent question we're often asked. Is it advantageous to register as an individual versus a facility? And there's really no difference in the way the awards are made. The only advantage if you apply as an individual is that you have complete control over the application process. If you are having a healthcare facility apply on your behalf, The advantage there is that they probably have some expertise in the gateway, and they may be able to navigate that system a little more quickly. Again, it's completely up to your discretion which method you choose. Another frequent question here is if you work for a federally run veteran facility, are you eligible? And the answer to that is no, because you're not listed in the above slide as one of the eligible applicants. There are many other qualifying criteria for who may apply. Those are on pages 2 through 6 of the RFA. So please refer to all of those individual criteria, read them carefully prior to starting the application to assist you in this process. Okay, use of funds. 3 ways that you can use funds. First and foremost is to repay qualified educational debt. Many questions surround this particular issue. These loans can be graduate or undergraduate loans. The loans must be in the physician's name, and the loan must be known as an educational loan. So for those who have refinanced loans into a HELOC, those loans are not acceptable. They would have to be educational loans. The second use of funds is to support a physician to establish or join a medical practice. And the third is to help healthcare facilities recruit or retain a physician. Some examples for use of funds in this category would be to give sign-on bonuses to a physician or to enhance their compensation. And we say enhanced compensation is much different than offsetting the salary. So we want to make that distinction. In all cases, 100% of the funds ultimately must be distributed to the physician or to the physician's practice. Application limits. No more than 1 application will be accepted from a single physician. No more than 2 applications will be accepted from a healthcare facility. That's defined as a facility with the same operating certificate number or a medical practice with the same Department of State identification number. The 2 application limit will apply regardless of whether the application is submitted by a physician or a healthcare facility. In either case, if more than the number of allowed applications are submitted, only the first applications received will be eligible for award and review. It's important to note that we encourage you to start the process to apply as soon as the gateway opens, and that the gateway will itself track the date and time of your submission. We also encourage you to attempt to make your application complete on the first attempt, and we will talk more about that later. This example hopefully clarifies some of the limits we just discussed. So for example, if XYZ Hospital submits 2 applications for physicians at their facility, we'll call them Dr. B and Dr. C, and Dr. A, who also works at XYZ Hospital, also submits an application independently. So in total, we would have 3 applications for service obligations at the same facility. No more than 2 awards will be made to support the DANY service obligation to be carried out at the same facility. Therefore, the first 2 applications with service obligations at XYZ Hospital will be reviewed. The award amounts. The RFA will provide the following: up to $40,000 per year for 3 years, to or on behalf of a physician who agrees to practice in an underserved area for the 3-year DANY service obligation. So that would total $120,000 per physician over the 3 years. We have up to $9 million in total state funding that will approximately allow us to give out 75 3-year awards. But additionally, there may be up to $1.5 million in federal funding that will become available, and we'll talk about the distinction between those funds later. Award limits on the department side. 1/3 of the funds need to be allocated to New York City. 2/3 of the funds can be allocated to the rest of state. No less than 50% of the funds allocated to obligations are for general hospitals. no more than 5% of the funds allocated to obligations and facilities licensed by the Office of Mental Health, and no more than 5% of the funds allocated to obligations and facilities will be licensed by OASIS. There are 3 key time periods that confuse people the most as they read this application, so we created this slide to differentiate what those dates mean. The first being a statement that the physician cannot have worked in any underserved area between the dates of August 10th, 2010 and August 30th, 2015. This time period does not apply to anybody who was in a residency or fellowship during that time. A physician cannot have an employment contract or business plan at the healthcare facility or practice that begins earlier than August 31st, 2015, or later than January 1st, 2019. These dates are chosen because August 31st, 2015 was the end of the cycle 4 for DANY, and January 1st, 2015 is the start of cycle 5. All grantees will have the same DANY service obligation dates, which will be January 1st, 2019 through December 31st, 2021. This is the first time the Grants Gateway is providing this opportunity to you. In past cycles, things have been done on paper, but we want to stress that we will not be accepting paper applications at this time. You must submit applications through the Gateway. And on the slide is the reference to the website that will direct you to the Gateway if you have not already been there prior to this point in time. So I'm going to turn the presentation over to Jeff, who's going to talk about registration in the Gateway and pre-qualification.
So I want to talk about the Gateway. Carolyn referred to our help desk, and it's important for you to realize it's out there for you. We have technical assistance available to you by way of a website and the help desk. So the website is the Grants Reform website, grantsreform.ny.gov, and on the Grantees tab, there are documents and information and guidance about getting registered, applying, and getting pre-qualified, which I'll talk about in a few minutes. There's the email address there, grantsgateway@its.ny.gov. Feel free to email them with any technical questions. Again, program questions they really can't answer. That's why the Q&A option is available to you to send to that DANY address, DANY2018@health.ny.gov. You can call our help desk anytime between 8 and 4 on weekdays, 518-474-5595. And also on the help desk is on the website is a calendar, training calendars. How to apply for a grant is one of them, but you're going to get most of that right here, so that may be redundant. Okay, registration is the first thing you would need to do if you as an individual or your organization is not yet registered. So all entities that wish to apply in the Grants Gateway need to be registered in the system. And it's just a matter of filling out a form, signing it, and getting it notarized though. So this is a actual document that has to be mailed to us. You have to get it notarized and sent to us. So obviously don't wait until 2 days before the grant is due, because you're not going to have enough time to get it notarized, send it through the mail, have us register you, and you apply. So do it as soon as possible. Information about registration can be found on the Grants Reform website that I just mentioned, and in the Grant Opportunity Portal as well, and I will show you both of them when I log in a little later. So pre-qualification is important to understand and know that you do need to deal with it if you are a not-for-profit. So all nonprofit organizations applying for grants in the state must be pre-qualified in the Grants Gateway prior to the grant application due dates. So you just have to be pre-qualified by June 13th when the applications are due. Okay, your organization must be qualified again by that date and time, and it must be in the status of pre-qualified or pre-qualified open. Pre-qualified means you're pre-qualified. Pre-qualified open means you're pre-qualified, yet you've opened it to make changes. Yeah, again, you're still pre-qualified. The good thing is, and this may help make your decision how you want to apply, individuals do not need to pre-qualify. So the active pre-qualification is providing documents and forms and kind of signing off on forms that essentially say that you are a well-run not-for-profit, right? Most not-for-profits have to have certain policies in place, or we want them to have certain policies and procedures in place to make sure they're well-run. There's also documents that are provided on a yearly basis. For instance, their IRS 990, an audit document, and a charities registration form. So those are things that need to be updated, uploaded, and approved in order for you to be pre-qualified. So if you're an individual, you don't have to worry about all of that. I'll talk a little bit more about pre-qualification also as we go through. Now, another thing you should be aware of are the user roles in the Grants Gateway. And this is probably the #1 question we get with people that are registering or people that want to apply. What happens is you'll send in your registration form to our help desk, they'll receive it, and they'll set you up with an account. But they set up an account for this person right here in the bottom left, the Grantee Delegated Administrator. That is a person who can only do 2 things in the Gateway. They can add or edit user accounts, or they can manage the document vault, what I talked about pre-qualification. So they can't start an application, they can't submit an application. So if you're an individual, you'll have to create an account for yourself in one of these other roles that I'll talk about. If you are working at if you're a doctor's office or a hospital or something like that, that is applying, they also need to create somebody in one of these other roles to be able to start or submit the application. So let's talk about the different roles here. Grantee, up here in the top left, they can start an application and edit an application, but they cannot submit it. So you can do anything that you want in an application up until the act of submitting it to us before the deadline. So if you're an individual, you might as well not bother creating that account, because you might as well create this, the Grantee Contract Signatory. Let me make that line a little straighter here. The Grantee Contract Signatory can start an application, edit anything they want in the application, and of course can submit the application. Now there's also somebody called the Grantee System Administrator, and they can do exactly the same that the Grantee Contract Signatory can do. So if you are an individual, you need to be in one of these 2 roles here on the right, Grantee Contract Signatory or Grantee System Administrator. And it's not just the act of changing your role, you have to actually create a new account. And we'll talk a little bit more about those accounts on this next slide here. So we talked about the delegated admin, can only add new accounts and work on the document vault. You must have somebody in a higher role that can submit the application. That would be the Grantee Contract Signatory or the Grantee System Administrator. User in the role of grantee can only start and edit the application but can't submit it. And the last point I wanted to make here, it is certainly acceptable for one person to have multiple roles and thus multiple accounts in the Grants Gateway. So you're going to have to, especially if you're an individual, you're going to have that Grantee Delegated Administrator and probably the Grantee Contract Signatory. So you can use the same email address, that's fine. You can even set it up with the same password, that's fine, but realize you'll have 2 different roles that you would log in at different times. So roles required for the individual, like I just said, Grantee Delegated Admin and Grantee Contract Signatory. You're going to get this first one when we register your organization or yourself, and you'll create the second one, the Grantee Contract Signatory, yourself. And if you're stuck with that, certainly call our help desk. We can help you out with that, or refer to the documentation. So what are your next steps? So obviously, first of all, make sure your organization is registered in the Gateway. You want to hit the ground running on May 16th, being able to start your application. So do that between now and then if you haven't already. If you're a not-for-profit, make sure you're pre-qualified or actively working to get to that status. Again, you don't have to be pre-qualified before you start, but you need to be before June 13th or by June 13th. Ensure that you have people in the organization in the right roles that we just talked about. And we definitely suggest download and read the RFA in its entirety. There's a lot of information there. There's a lot of guidance. There's a lot of things that if you didn't read, you'll probably end up with questions about that are easily addressed by just reading the RFA. Start your applications, the sooner the better. Again, you can't start it now. We want you to prepare for it, though. We'll be giving you the documents that you need to prepare and uploads you need to do and questions you'll need to answer. So you can certainly get started with those, answering those questions in a Word doc or something like that. And then, of course, submit your application prior to the deadline. We suggest trying to do it 24 or 48 hours in advance. A lot of people rush at the end and then run out of time, and we don't want you to be one of those. Don't set yourself in the position where you're going to run out of time and lose this opportunity. So again, you can start your work on your application even if you are not pre-qualified yet, if you're a not-for-profit. And again, if you're an individual, it doesn't matter because you don't have to worry about pre-qualification.
Okay, so the next slide is really what happens next after you apply. So the review and award process. The department will do two things: review the applications in the order that they're received in the gateway. And as mentioned previously, the gateway does date and timestamp those automatically. Then we will notify the applicant via email. This is important for you to provide an accessible email address. We'll let you know via email if the application is complete or incomplete. Now, in previous cycles, there's been a lot of back and forth with questions and answers and missing information. It's somewhat changed in this cycle. So let me go back to if the application is deemed complete. If it's complete, we'll tell you so. There's no further action that would be necessary. However, just because you have a complete application doesn't guarantee you funding. It just means that you are in the queue. Next slide. If the application is incomplete, what we will do for you is provide a list of outstanding items, and we will send that list to you via email. The applicant will have one opportunity, and this is different in this cycle, one opportunity to supply the missing information via email to the department within 10 business days from receiving the list. So it is important that you promptly respond and that you include all items that are being requested in one communication. All the correspondence will take place through our DANY 2018 inbox. This information will not be going back and forth through the gateway. And the department will not be able to accept late submissions. So it's important that when you receive that email, the clock starts and you have 10 business days to get back to us with what we feel is missing information. The review and award process, just to give you an overview in very general terms, funding decisions will be made in the fall of 2018. So that gives us a few months to look at the applications and make assessments. However, the contract dates for all grantees will be January 1st, 2019. I know there's been some questions about that, when the contract start date will be. It is the same date for all applicants. Please know that we can't accept phone calls inquiring on the status of your application. Most of the back and forth communication on our funding decisions at that point will be done by mail. So you'll be receiving a letter from us sometime in the fall letting you know if you've been funded or not funded. Payment and reporting requirements. So this is key information for grantees who are eligible and have been selected for the grant. No advance payments will be made. No payment will be made before a contract is executed. So a physician must work for 3 months under the terms of the DANY contract before the first payment will be made. Payments will be made going forward either quarterly or semi-annually based on the discretion of the department. And as a grantee, the following reports will be asked of you going forward, and they will be asked prior to receiving your payments. So for example, we'll ask for progress reports to verify your continued employment with the employer. We will ask for educational loan statements. The reason we ask for this is to ensure that the monies are being applied to the balance. And if you are a healthcare facility who are using funds to recruit or retain a physician, we'll look for expenditure reports if that's applicable. This section is quite extensive. I hope you've had a chance to look at the attachments that were posted. There are 11 total, and 2 of them are for reference only. So I'm going to briefly go through these attachments. I'm certain that there'll be many questions, but again, hoping that you have a familiarity with them already. Attachment 1, which is starting a grant application, is actually a form that's been completed by Jeff and he uses for teaching purposes. We've posted that there for your reference. Application cover page, which is attachment number 2. that is a document where you're really providing to us a high level of information on your application process. We're looking for the individual physician to be named.
And we'll go into that when I do my.
Okay. So we'll go through that in greater extent later on. One portion of that attachment that's important to note now is Section 3. There is an attestation that you'll be signing off on, and that attestation just verifies that the information you're providing is valid, both in the gateway and in the attachments that you're uploading for our purposes. Attachment 3 is site information. We may have physicians that work at more than one site. So we're asking you to fill out one page for each site where you'll be working and upload those pages separately. Attachment 4 is only applicable for those who are asking for loan repayments. So if you are that individual, we will ask you for a statement from your loan provider that we in turn can validate that statement with HESC. And again, the next attachment, which is 5, is only for those who are looking for loan repayment. We need you to sign a disclosure statement that says we're able to speak to HESC on your behalf and validate your loan status. Attachment 6, there's been many questions on this, and there's a slide later on that we'll talk to in greater detail, but we do require a copy of your employment contract or business plan, and much of the detail for this is defined in Section 2A of the RFA, and we will discuss that further. Let's see, attachments 7, 8, and 9, defining an underserved area. This is a big one, and we will go through those slides independently as well. That'll be the next thing that we tackle. Attachment number 10, which is an attestation. This is not necessary for all applicants. So you'll see in the RFA Section 4M, Vendor Responsibility Questionnaire, that a questionnaire is only required from healthcare facilities applying for an award of greater than $100,000. If you are an individual physician applying for this grant, you do not need to complete that questionnaire and you do not need to do the attestation. Again, so it's only for healthcare facilities requesting greater than $100,000. And attachment 10 is the user guide. Again, this is for your reference only. It has some Grants Gateway information that you may find helpful throughout this process.
Attachment 11.
Oh, attachment 11, sorry. Thank you. So the next slide does begin talking about this grouping of attachments that are most important, which is attachment 7. So this is where you as an individual are looking to define if where you work is an underserved area. And there are 3 separate ways to do this, option A, B, and C. This is probably the second most asked about question that we get. You only need to complete one option. You do not need to do more than one. So hopefully you'll find one that you can easily answer and complete. Option A is for primary care physicians and psychiatric physicians who work in a HPSA, MUA, or MUP. We'll go through that in a little more detail. Option B is a primary care or psychiatric physician who works in a rural county or town. And option C is an alternate method. Again, you just need to complete one of the 3. So if we look at option A, this is for primary care, and that's defined as general internal medicine, family practice, general pediatrics, geriatrics, and OBGYN, or psychiatric physicians. They have to be working in a HPSA, which is a federally designated primary care or mental health professional shortage area, a MUP, which is a medically underserved population, or a MUA, which is a medically underserved area. So you'd ask, well, how do I know this? You would link to this website address that's provided in the slide, and you would type in the address of where you're working. It's then going to give you, the search criteria will go out, it'll come back and tell you if where you're located is defined as one of those 3 areas. If you're successful in doing so, print out the validation from the website and you're going to be uploading a copy of that proof as attachment 9 in the gateway. If that option does not work for you and you want to look at option B, again, it's for primary care and psychiatric physicians as defined previously. In this instance, perhaps you're working in a rural county or town. So attachment number 8 gives us lists of various counties and towns that have been identified as rural. If you are working in that town or county, all you need to do is circle that on attachment 8 and upload that proof along with any notations that you feel are necessary as attachment 9 in the gateway. Okay. Option C is a bit more complicated because it requires some additional supporting documentation. This option is open to physicians from any specialty. What you need to do is read all 17 questions provided in option C. You have to answer all 17 questions, and you have to be able to answer yes to 6 of those questions on the list. Now, each section of questions provides directions on what type of supporting documentation is going to be acceptable. So, again, just read through the questions, understand what supporting documentation you're going to need to justify that yes answer, print all that stuff out, put it together, and you're going to upload that as attachment 7. As attachment 9 in the gateway. Program information. These are questions that you're going to answer directly in Grants Gateway. And I think, Jeff, you'll show some examples of these questions. Most of these questions in the gateway are going to be yes-no questions. It also requires the applicant to name the physician who will be completing the DANY service obligation and the physician's specialty. And again, you are attesting to the truth of these questions in section 3 of the application cover page. One section in Grants Gateway is our work plan, and we have a grantee-defined work plan. I don't want this to be overwhelming to anyone. Really, there's a very limited number of information that you need to enter into this area of the Grants Gateway, and here on the slide we've highlighted the key elements that you have to include. As mentioned before, the contract period for all applications are the same. It's going to be January 1st, 2019 to December 31st, 2021. In the project summary area, we're going to have to enter the counties of service and the medical specialty that the physician has. And objectives and tasks, they'll be pre-filled in for you in the Grants Gateway, so it's not anything you have to worry about keying in yourself. And performance measures, you're going to type in the following. Fulfill the service obligation within the 3-year contract term. Now, this all may sound confusing, but we're going to show you on the screen exactly what we're talking about and where you'll type this information. There's one type of budget for this grant opportunity, and that is a fixed term expenditure-based budget. That means that the grant funds coming to you will be fixed, set amounts, equal amounts each year of the 3 years of the grant. Now, there's 2 ways to complete this budget. Again, if you're an individual who is requesting funds to repay educational debt, this would be the way that you complete this section. In the expenditure budget, you would enter repayment of educational loans. For justification, you would enter repayment of educational loans. The total grant funds, this is where you're going to enter the amount that you're requesting. So that shall be no more than $120,000 over a 3-year term. In the section labeled Other Narrative, you're going to indicate the total funds requested per year. So, for example, if you're asking for the maximum amount of $120,000, you'd enter $40,000 a year for 3 years. If you're requesting less than $120,000, divide the total amount by 3 and enter that amount per year for 3 years. The second way of completing this budget is for someone requesting funds for anything other than repaying qualified educational debt. The same titles and sections appear here. So under the expenditure budget, you're going to enter the information for relevant budget items. You can add as many budget items as you need by clicking the Add button. You can continue to add 2, 3, and 4 budget items. And there's a section of the RFA that lists all the eligible expenses. So this is really going to pertain to healthcare facilities who might be using funds to recruit, retain a physician within a practice. And there might be valid expenses that they need to itemize to do so. In the narrative section, you'd provide a detailed justification of why you're requesting that budget item, why you think it's important and critical to the recruitment of that physician. And then the total grant funds is going to be filled out exactly the same way. It shall be no more than $120,000 for a 3-year term. In the other narrative section, you would also do the same. If the total funds you're requesting are $120,000, then request $40,000 per year. If you're requesting less than $120,000, then divide the amount you're requesting by 3 and enter that in for each of the 3 years. Remember, when you're doing this, it might take you a while, so continue to click Save on the page as you work with it, so any information that you're entering in the gateway is not lost. And keeping in mind that these budget items that we're listing here, the funds from the grant, 100% of those funds need to be going towards the physician or the physician's medical practice. Default provisions. This is a critical element that everyone should read and understand. At the time of contract, a physician will be notified of the source of their DANY grant funding. So there are going to be those applicants that are funded 100% by state funds. And there'll be other applicants who are funded by a combination of state and federal funding. It's important that they know the difference of where their funding is coming from because they have different default provisions. And those default provisions are spelled out in the RFA. The overarching theme is that you're committing to a 3-year DANY service obligation. And if you default on those service obligations, there are severe financial consequences. So read them, understand them, ask questions. Anything that's uncollectible or a failure to repay the specified amounts defined, they'll be referred to the New York State Attorney General's office for possible legal action. I know it sounds severe, but we really want you to be aware of these specifications up front. Second question that we see a lot is contract modifications. If you find a year or 2 in things change, the decision to permit either of the following is at the sole discretion of the department. So the change of a service location for a physician or the deferment of a service obligation for a physician. You need to contact the department prior to taking any action, and you need to obtain approval for any of those changes prior to them taking place. It's hard to spell out the different scenarios, but you know, often someone might take an unexpected leave of absence for a pregnancy, and that's something that we can work around and accommodate, but we just need to know in advance that that's going to happen so that we can alter your service date terms. And tax issues, another important question. Currently, the funds to support loan repayments are exempt from federal and state taxes. So you should not receive a 1099 statement if the funds are for loan repayments. Funds for other purposes other than loan repayment are currently not tax exempt. And we do strongly encourage you to talk to your tax professional if you have tax questions. It's not our area of expertise. We always want you to defer to your tax professional. Other scholarships and loan forgiveness. So these are just some key points that are summarized here. No other state or federal loan forgiveness obligation can overlap or coincide with a 3-year DANY service obligation. The only exception is the Federal Public Service Loan Forgiveness Program. Those who are participating in that program, there is no conflict, but for all others, you would not be able to have any overlapping dates. Also, if a physician has previously participated in the DANY program in previous years, you would not be eligible to apply for Cycle 5 funding. Some key points summarized for what we're looking for in an employee contract or business plan. We realize that these can differ greatly, but there are key features that must be present. First of all, dates must cover at least the 3-year service commitment for DANY, which includes January 1st through December 31st, 2021. You have to name the facility where the service obligation will be carried out, so where will the physician be working. The physician has to be in full-time working status. That equates to 40 hours a week with a minimum of 32 clinical hours for a minimum of 45 weeks per year. And on-call hours can be used as working hours if it is regularly scheduled and the physician must be providing patient care on site. For example, you can't take on-call hours at home, but if you're on call and at the hospital, then those are qualifying hours. So how will questions be answered going forward after this webinar? As we mentioned, we're going to try to answer as many of those questions today as we're able, but a few options that are available to you. The webinar link of this presentation will be posted shortly after our live event, so you can rewatch this as many times as you feel you need to. In addition, you can submit questions to us at DANY 2018. That will reach us at the department. All questions are due in writing by May 2nd. After May 2nd, a reminder that the department can only answer questions of a technical nature. So please go out and do your reading, ask as many questions as you feel you have right away. And all of the questions that are asked, along with all the answers, will be posted in the Grants Gateway for anyone to read. So that will be forthcoming as well.
First thing I want to point out is we talked about that grants reform website, and I want to go to that just to show you where to apply. So if I go to grantsreform.ny.gov, we're actually updating this website. It'll be done probably in August or so, so it's a little confusing right now, but the way it works is there's this Grantees tab here. So I went to grantsreform.ny.gov, and you can go to the Grantees tab, and you can see that there are some links on the left side here. Information about registering, pre-qualifying, and applying, and then also the user guide. So there is this Grantee user guide right here. There is on the bottom the vendor pre-qualification manual, which will guide you through pre-qualification. There is the registration form. So let me click on that because a lot of people have been asking questions about this form. So this is the registration form that we make available to you to send in to us, again, via mail, and it has to be notarized by a notary. So a couple questions that we get from people that are signing up as individuals. So legal name is your name. Federal ID, we need something here. And if you're not an organization with a federal ID number, it's your Social Security number. So we do need your Social Security number here. And if you don't want to send that through the mail, that's acceptable, that's okay. Maybe just write in there, will call with SSN or something like that. And then we need you to call our desk, our help desk, and say, hey, the form I sent in, this is my Social Security number to put in there. You know, you don't have to do that, but if you're against sending your SSN through the mail, you can certainly have that option. We need your street address, your city, state, zip, and you would be checking if you're an individual right here, or if you are a not-for-profit, you'd be checking not-for-profit. The delegated administrators, these are the people who are going to be that grantee delegated administrator role that I told you about in the beginning. So if you're an individual, there's not a plural of administrators here, it's just you. So you'd put your own name here yet again. If you're an organization, we ask that you provide 2 people in case one leaves or one's hard to get a hold of. Remember, those are the people that can create other accounts in your behalf or on behalf of your organization. Then the head of the organization needs to sign it, and again, if you're an individual, that's you. So you'll just put in your name. You don't necessarily have to put in the title. You can just write individual if you want, your phone number, your email, and sign it and date it. And then it has to be notarized by a notary public, and they would sign it and stamp it here and write in your name up here. Okay? The second page is instructions. If you are doing this for the first time and you are a not-for-profit, you need to provide a substitute W-9 document, and it's just a one-pager also that needs to be filled out, and there's a link there to it as well. And down here, it gives you the address to send it to. So you would send your completed form to this address, which is the building we're in right now, and our help desk would receive it and get you registered. The act of getting you registered is literally, it takes 3 minutes after they open your mail. So it should be pretty quick, but again, don't wait till the last minute. Do it as soon as you can. So again, that was from the Grants Gateway, the Grants Reform website, I should say, grantsreform.ny.gov. We went to the Grantees tab, and we clicked on this registration form for administrator. There's one other place to get that form, and I'll show you that in a few minutes. The last thing on this site is videos, and there are 2 videos that might be applicable to you. One is registration, talking about getting registered and what to do after, essentially what I just talked about, and the other is pre-qualification. It actually walks through the whole process of getting pre-qualified, filling out the forms and submitting them. So if you're a not-for-profit and you need to do that and you're confused about it, you can start there if you'd like. Also, again, I mentioned the manuals. There's that pre-qualification manual down here. So that's the Grants Reform website, and then there's the Grants Gateway website. And if I go to Grants Gateway, let me just erase this, gateway.ny.gov, and hit enter, it brings me to this website. Couple things to point out though. A lot of people are in the habit of always typing www when they go to a website. And I just want to point out that that's not really valid here. If you hit www, look what happens. It gives you a warning that the site is not secure. That's not a problem with our website. It's the way that the state of New York sets up their secure HTTPS websites. So all their secure websites work only on the non-www version of it. So you go to grantsgateway.ny.gov and you're in business. If you went into www, it says that the certificate is invalid. So on the Grants Gateway site, you've got the login in the top left, which we'll do in a little while, but you're brought to the portal to begin with. This is open for anybody in the world that wants to just browse and search for grant opportunities. So we'll look at that in my test system in a while to see the DANY one. But notification and registration right here, request access now, is another way of getting that registration form. And there's a form right here in section number 2 to fill out. That's that exact same form I just showed you. So that was on logging in or going to the grantsgateway.ny.gov, clicking on registration and getting that form from there. Notification, you can click on sign up now and sign up to be notified when grants are offered. So this is actually a good idea for you. We're going to be posting it under, I imagine, education supports. So if you signed up right now or before May 16th and you signed up to be alerted of all grants that are posted in relation to education supports, you'll be emailed when it's out and you'll actually get a link directly to the RFA. Okay. So yeah, it'll be under health services as well, so make sure you're signed up for that if you want to be alerted. Okay, so I'm going to go to our testing website here, our training website, and I'm going to log in. And you'll remember that we talked about different types of logins. So I'm going to log in as an admin just to show you what it would look like to add new users. So I'm going to log in. Usually your username is your first initial, last name, and then a number with a max of, I think, 9 or 10 characters. So I log in, and I can see that I have a welcome sign, and it does confirm that I am in the role of Grantee Delegated Administrator. I've got a bunch of options on the screen here. The layout of the screen is this. Think of the top as searching. I can search through the portal for open opportunities. I can search for any applications, contracts, or payments that my organization might have, or if I'm an individual, that I may have as an individual. So if you had started your application, you could go here to applications and find it again and continue it. Contracts, once you're awarded a contract, if you are, you'd be able to find it there. Progress reports, we're not going to be using, I don't think, in the gateway for this, so don't worry about it. Tasks would be related to contracts later on. So the top part is searching. The black bar here is, let's say, administration. So there's a link to some training materials, some of the things I already showed you. Information about your organization, which I'm going to do in a second. Profile is your personal profile, where you can change your password or something like that, and then log out would obviously log you out. And then the blue bar we'll call an action bar, because there are buttons there, such as the Save button or Add button, that will be available if those options are available to you. All right, so let's look at organizations, because I can go in here as the Grantee Delegated Admin. Ignore this page, it's just in our test setup we have 2 organizations. I click on organizations and it brings me to my organization name, example NFP. And if I'm the Grantee Delegated Admin, I can go to Organization Members, Add Members, New Member, and create that new account. So it can be Jeff Grantee, I'll do X because I have so many of them already set up. And maybe I can say, you know, write whatever your title is or this person's title is, and then the email address. And then the important thing here is the role. And I would want to be a grantee contract signatory if I'm the person that wants to start, edit, save, and submit my application. So if I do that, sometimes the email address, the phone number is not filled out. You'd have to do that. And if I hit Save and Add to Organization, I've then created that new person's account. They'll get an email. I know I wrote email dot. I'm just saying that. It would have given me an error. It will send you 2 emails. One is, welcome to the gateway, this is your user ID, and the other is, this is your temporary password. You would log in with that temporary password, you would be asked to change it, and then you're in business. That will happen automatically for the 1 or 2 Grantee Delegated Admins. So you'll know we got your form and we know you registered you because you'll get 2 emails, one that says welcome and one that says here's your password. All right, so that's adding members. Again, organization members, add member, and new member. And I can see all the current members I had. And one important thing to note, it does appear that you can just simply change someone's role. Don't do that. It does allow it, but it doesn't work and it messes things up. So I just wanted to point that out. Don't do that. It would be nice if it worked that way. All right. So back to my home page. The other options we have are your inbox and tasks. So I'm a Grantee Delegated Admin. I can't apply for a grant. You'll see when I log in as that signatory, I'll have a different option that'll allow me to apply for it. My inbox, I can look at my inbox, any messages I received, but ignore it. There's really nothing you need there. It's a copy of any emails that the system might have sent you. It doesn't allow you to do any work in the system. It doesn't give you any more information. It's just a copy of emails. So if it was passwords or something like that, it would be a copy of that information. My tasks, I probably have tasks related to pre-qualification, and I do. You can see my document vault's expired. So that's something related to being a pre-qualification or a Grantee Delegated Administrator. All right, so I'm going to log out, and I'm going to log back in as that person that can actually apply. But before I do, let's look at the portal and actually find the grant opportunity. So if I click on Search, so I'm at the portal, I'm not logged in, I click on Search, and then the RFA tells you can type in the whole name. You don't have to. If you just type in the word doctors, and hit search, it'll find all grant opportunities out there with the word doctors in it. And of course, the one that we're looking for is this, Doctors Across New York, Physician Loan Repayment and Physician Practice Support Programs, Cycle 5. So in my case, it's available in our test system. Again, it's not in the live system just yet. It's available for individuals and not-for-profits. It's offered by the Department of Health. availability date will be actually May 16th. You can ignore this, and then the due date will be obviously June 13th, which we talked about. So maybe I want to find a little bit more information about it. Again, I can't apply just yet, but I can click on it and look at some of this information. So what I see here is on the left is the opportunity profile, and on the right there's some additional information. So the ID, you'll see it as DRPLR5-2019. Every application that's submitted will be this number plus a unique number after it. So the first person that applies, it'll be 00001, 0002, and so on. Agency, obviously Department of Health. There's that full name again, Carolyn's name, and the email address that she talked about to send questions to. And then the solicitation profile is just a few paragraphs, information about applying for it. We'll skip this button down here for now. On the right is the full announcement link. Again, that very important date, due on June 13th at 4 p.m., not 4:01. The system will not allow you to submit any applications after 4 o'clock on the 13th. We anticipate the awards will be made around September 1st. We talked about 3-year contracts. There's a total of $9 million in funding available. We talked about the Q&A and how to send it. Questions and answer document will be posted right here. So you can see it's going to be an upload, and right in this box that I'm kind of circling around will be a link to it. So obviously there's nothing here yet, but on 5/9, on May 9th, we'll have it. Now this says 12 a.m., ignore that. It won't exactly be 12 a.m. It'll probably be, I would guess, later on in the day. But there'll be a link right here for you to click on and see that entire PDF document of questions and answers. All right, again, those eligible applicants, the target populations, and that service area, this is what drives that email. So, if you had picked health services, you would have received an email when this was posted. Last thing I want to point out here is this View Grant Opportunity box. This is where the RFA is right now. So I can click on it, and it allows me to open this PDF or save it, and this is it. So this is the RFA, Request for Applications, and you can see it's 55 pages. We're not going to go through it in details right now, but please do read this, be familiar with it before we open this up on May 16th. You want to be really good, you really want to know what's going on, you want to be prepared before you start your applications. So page 1, there's all those key dates again that we talked about. Table of contents on page 2. And I'm going to be referring to this as I go through my application in a few minutes. You can see the attachments are down here at the end on page 33 in section 6. And in section 5 is completing the application. So it goes through some of the things we're going to do right now. One of the other important things here in completing the application is it gives you all of the questions. So I skipped down to page 21. These are all the attachments that Carolyn already mentioned, and then all the exact questions you will be asked. So starting on page 22 and going through quite a few pages are the questions you're going to be asked. Again, a lot of them are yes or no's. Some of them ask for dates or your name, things like that. But it's good to have these. Maybe you want to print these pages out and just circle what your answers are so that you're prepared when it comes time to actually fill this out in the gateway. That's what I would do. All right? So let's get into actually applying for it. Now, I can't apply here because I'm still just in the portal. A lot of people say, oh, I'm logged in as the right person, but why can't I apply for it? And I'll show you why. I'm going to log in as, if I log in, it says, welcome, Jeff. I'm a grantee contract signatory. There's a new thing here that I didn't see in the previous page, which is view available opportunities. So a lot of people think they go here to the portal, they search for doctors, and they're in business. No, that's just to see the announcement. To actually apply from your home page, log in as the right type of user, click here on View Opportunities, and search for it here. So again, I'll search for the word doctors, and hit search, and there's only one out there. So I click on it. This should look familiar to you. It looks exactly the same. However, the button now says Apply for Grant Opportunity, not View Grant Opportunity. So I'll click it, and I've now started application number 1. You can see I'm 00001. All right? So filling out your application means going through this Forms menu here and filling out the required forms. So let's go do that. The other buttons are menu. This brings you back here to the main page. Status changes, that's where I can submit it later on. Management tools, nothing you really need to do here, but you can check for errors if you want to double check before you submit it. You can add or edit people to it. That'll just give a task to them, people from your organization. And you can ignore progress reports and related documents. That would be used later on if you receive the contract. So again, Forms menu is where we're going to be working. You can hover over it. Or it's a lot easier just to click on Forms menu and see the whole menu. Contract document properties, nothing you need to do there. You can simply look at it. This is an example of what a master contract looks like. It will be the attachment A1. You can click on View File to see that. That is the program-specific terms and conditions. And it'll also show you any additional attachments that would appear in the contract. So that first section is for just for your reference. Somebody just asked the question, is there a preferred browser to use? I'm using Internet Explorer. It's based on Microsoft.NET, a slightly older version of it, so it is obviously made specifically for IE. However, it works fine in Chrome and Firefox and the other browsers, Safari. There are a couple oddities where things that are usually centered on the page in IE are kind of adjusted to the right or something like that. But besides that, it works perfectly fine. That was contract document properties. The other pages here, the next section is application information. I could print my application. It's not worth doing now because it's blank. Again, another link to the RFP or RFA in this case. We could click on that. And application versions, this is important. This is what will be submitted. This is what you will submit once you're done and submit your application. So what happens is I'll go and fill out all these pages and I'll submit my application. About 5 or 10 minutes after, an application version will be created. That's a PDF that will be good for you to save if you want for your records, but you'll see that's exactly what the Department of Health will be looking at to read and review your application. So we'll have plenty of time to look at that after I submit it. So let's start here in program information. You need to fill out your project site address. So where will you be working? Where will this be performed? So I'll just say example hospital and 123 Main Street. I'm just picking Albany, although I'll probably pick a different county when I go to answer the questions. You would not do that. Regional council, agency specific region, you don't need to worry about that. Correct? Okay. So I'll hit save. And it's now saved my hospital. Yeah, so you will be, if you had multiple hospitals, you'll be doing it on one of the other forms that we have, so there's no point in doing it here. But you do have to, of course, provide one. All right, well, that was easy enough. That was the forms menu, project site addresses. A lot of the work you're going to be doing will be here in program-specific questions. So you click on it, and it asks for your project title, and then it goes through a bunch of questions. Now, I only have part 1, 2, and part of 3. If we go back to the RFA, remember there's 3, which has several sub-questions within it, 3A through P. We have 3Q, R, S, T, U, V. We've got section 4. So a whole bunch of other questions you need to answer, but for testing purposes, I only put in a few here. All right, project title, you're going to want to put in loan repayment program. And you'll go through and answer these questions. Again, hopefully you've looked at the RFA, you've already answered them on a Word doc or you've circled it or whatever, and it's just a matter of you coming in and doing data entry. Are you an individual physician? I'm going to say yes for this. Are you a healthcare provider? I'm going to say no for these others. If you take a look at Part 1, applicant identification, you are not eligible unless you can answer yes to one of the following 5 options. So I answered yes to I am an individual physician applicant. Part 2, physician identification, provide the name of the physician who will be completing the DANY service obligation. So your name would be going here. You can see we provide the number of characters that are allowed, and you'll see how many you've typed as you went through. Some more yes/no type questions. So minimum eligibility. Now 3, remember I said section 3 had something like 20 sub-questions within it. I've only done 2 because I didn't want to answer them all through this webinar. So you're going to be answering these questions, and notice though that there is comments on the top that says the physician who is completing the DANY service obligation is eligible to participate in the program only if the applicant can answer yes to questions A through P. So if you answered no here, that's it. You know, that you've answered a question which means you're not eligible for it. So that's another reason why doing your homework ahead of time, looking at the RFA, will make sure that you're actually eligible to apply for it. So, you know, I only put in these few questions here. There's a whole bunch more to do. As you're going through, please make sure that you answer the questions and hit save as you go through periodically. It's not letting me see my save button. There we go. So notice what happened. I hit save, and it said, wait a minute, question 3B requires a response. Why is that? Anything with a red asterisk does require a response. Now, the good thing is it saved all my work. I can leave and come back later, and let's do that. I could log out. I'm not going to do that, but I could log out, log back in, and I can go and find my application that I just started. How do I do that? Well, now I've got a task where maybe you didn't have before, or maybe before I only had 3. Now I have 4. I can click on Open Tasks and find that application that I started right here on 4/25. And I can click on it and get back into it and go to that page. Or I can go to Applications and search for all the applications that I have started. If you've only done 1, you can leave everything blank and hit Search. If I have several, or I just want to narrow it down, I can type in the word doctors again and hit Search, and there it is again. So you can see I did some in previous years as well. So I can click on this one. Oh, that's 2016. I can click on this one and get back into it. So it brings me to the main page. I can go back to the Forms menu, and I can see, oh yeah, I left off here at program-specific questions. So the point there is, obviously, you don't have to do it in one sitting. However, you do have to answer every question that's required before you submit it, and it will warn you and won't even let you submit it if you have these errors. This is why we say it's a good idea to try to submit it 24, 48 hours in advance, because what if you missed something and you didn't realize it, and you're waiting till 3:57 and you hit the button and it says, oh, you've got all these errors because you missed these pages. So don't get yourself in that position. Try to do it ahead of time. All right, so imagine that you've gone through and filled out all those questions. I'll answer this one and hit save on it. And we'll move back to the Forms menu. And next is the budget. So the budget, it seems kind of daunting because there's a lot of sections here, but it should be pretty easy, especially if you're an individual. And we talked about in the PowerPoint and in the RFA itself, we talked about putting it in the category of other, and that's down here at the bottom, other expenses detail. And if we go here, you can see it's got a name, a justification, and the grant funds, exactly like Carolyn explained in the webinar. I don't remember them, so I'm going to go and search the budget, and that should be easy enough. And she's trying to find it here. Okay, here it is. So this is on page 33, and it's repayment of educational loans. All right, so that's easy enough. Repayment of educational loans. And you can put the same thing in under justification. And how much money are you asking for? So remember, this is not per year. This is for the full three-year term of this contract. So if you're asking for $40,000 a year, you're actually asking for $120,000 here. You can't go over $120,000. All right. So in my case, I'll just put in $120,000. I'm asking for the maximum that's allowed, and I'll hit save. By the way, that's one other thing that's different in the different browsers. In IE, this blue bar follows you as you scroll through. In the other browsers, it stays up at the top. All right, so I put in that. Now, you'll also remember in the presentation we said you need to fill out the narrative as well. And if we scroll down here, I put in other expenses detail, and you can see I just did it, but I didn't put in the narrative yet. So I'll go to other narrative, and I'll say how much I'm asking for. So requesting $120,000 for 3 years at something like that. So you're breaking down the amount of years, what you're asking for each year. And I'll hit save. Okay, so that's pretty straightforward. If you were applying as a not-for-profit or as a hospital or as a health services provider, there's other options you can put in the budget here. You could put in the grant funds in the narrative as well, and the guidance is in there in that PowerPoint and in the RFA. All right, so that's simple enough, but you do need to go to the expenditure summary. If we didn't, it would give us an error later. It just wants you to double check what you've put in. So I click on expenditure summary, which is at the bottom of the budget, and it says, what have I put in for in each category and what does it add up to? So I've put in for $120,000, its subtotal is $120,000, and the total is $120,000. So pretty straightforward. If your number is higher than that, you've done something wrong. All right, so that's pretty easy. And then the last part is the work plan. So it's separated into two sections, the work plan overview form and the objectives and tasks. The work plan overview form has a couple sections in it. And the first thing is the work plan period. And of course, we already talked about that. That's going to be 1/1/2019 to 12/31/2021. That's 3 full years, January till December. All right, so the next thing is the project summary. You can see this allows up to 50,000 characters. You certainly don't need to do that. What we want is you to just put in the counties of service and the medical specialty. I'll just say Ulster for some reason. And then medical specialty. Give me one. Pediatrics. Okay, and that's it. It's pretty simple. I use 58 of my 50,000 characters available. Okay, so this organizational capacity section you can see is required because of the red asterisk. There's nothing we can do to turn that off. It's just part of the grants gateway. And it's usually asking an organization to say, how are you able to actually provide this or perform the duties of this contract? You don't have to worry about it. So you can just put in NA here and hit save, and that'll satisfy the requirement to put something in that field. So again, to review this, the work plan overview form, put in the dates exactly as shown, put in your specialty and your county, and just put in NA and organizational capacity, and you're all set with this page. Last thing, we'll go back to the forms menu, and there is the, not last thing, but last part of this section is the objectives and tasks. So the way it's set up is there's one objective called healthcare services. There's one task called providing healthcare services in an underserved area. And there's a performance measure, which you have to click on View, Add, and then type in, I forgot what we're going to write, and type in, fulfill the obligation within the 3-year period. So maybe the name, you do have to put in a name and a narrative. So I'll say fulfill obligation. And my narrative will be fulfill the healthcare, wait, where is it?
Obligation.
Oh, just obligation, okay. Fill the obligation within the 3-year period, okay? And hit save. So you may be wondering why you do that. This is something that'll end up on every contract. So if you were to receive a contract, it's saying what are the objectives, tasks, performance measures that this person will do to fulfill this contract. And in this case, we're making it pretty simple for you, giving you this one kind of generic overview of what you're doing. All right? And maybe I'd write obligations, plural, but doesn't matter. Okay, back to the forms menu. Now, the last section that you have to worry about here is the pre-submission uploads. And you'll remember in the document that we talked about, if I scroll back up to page, at the beginning here, page 24, it talks about all those attachments. Some of them are Word docs they have to fill out, some of them are just for information only, and so on. So I go back to my application, and I go to pre-submission uploads, and I've got only 4 here. Realize in the real one you'll have 11. And remember, at the very end of this 55-page document are all of those specific attachments. Here's attachment 5, here's attachment 6, and so on. So again, you can be prepared before May 16th to get everything ready and be ready just to simply upload. So if you're not prepared, or if you want to do it here, that's fine too. Some of them are for reference only. The first one and the last one were reference only. And there's a template for you just to click and upload. And this is a document showing you how to start an application. Now, of course, you've already done that, so it's really not necessary here in this part. Attachment 2, though, is required. It's a red asterisk, and it's the application cover page. And we can click here again, the template, and open it up, and enable editing, and we fill this out. You provide your name, your address, identification, your Grants Gateway vendor ID. Where do I get that? You have to get that actually, if you look at your organization information, and if I click on it, your vendor ID is right here on the home page of your organization information. So in this case, it's this 100000624. So I just got out of my application. That's okay. I can go back to applications or back to home and look at my tasks and get back into where I just was. So you should have that number available so you don't have to do that and click out. All right, so let's say I fill out this document. I'm really not going to right now, but I'll save it. And I'll just save it to my desktop. And I'll call it app cover sheet. And I'll save it and then attach it here. Okay? And I'll do the same thing with site information, loan statements, if applicable to me, and so on. I'm not going to really do those, so you just click Browse, you find your attachment, and you hit Save. Another difference between browsers, it says Browse in Internet Explorer, it says Choose File in the other browsers, but obviously it works the same. So you will have gone through all those 10 or 11 attachments and filled out what you needed and provided them here. And you would be saving periodically. I wouldn't do it all in one shot. Maybe upload 2 and then hit Save. It's not really uploaded until you hit Save. So do 2, hit Save, do 2, hit Save, and so on. You can double check what you've uploaded by clicking the View File here. And that's important because you don't want to, sometimes people upload the same document 2 times in a row and, well, you didn't upload the right document. So what are we going to do about that? So you can click on View File and verify that. In this case, I just did the sample attachment. All right, so it is important to make sure you get the right ones there. Again, it doesn't have to all be done in one setting, and again, it's a good idea to be prepared ahead of time. All right, so I'm pretty much done here. There's nothing else I need to do. There is this Grantee document folder, and I don't foresee you needing to use it, but I'm mentioning it now just because people ask about it. It's just kind of a catch-all for any other documents you might want to upload, but we're not asking you to do that, so please don't. We don't want any extra documents that aren't asked of you. But from there, that's where you could add additional documents. Again, please don't. All right, so I've done everything I think I need to do. The due date is approaching. Maybe it's 48 hours in advance right now, and I want to submit it. So if I go through, I might want to double check everything first. You can certainly go through each page if you want. You can click on this print application. And we agree it's not really that elegant looking at it, but it does show everything, so I could print it if I wanted to, or just look at it. This shows all those pages that we just did in order. So I can see how I answered these. Yep, I meant to answer 1A as a yes and all the others as a no. You can see all the answers you put in. You can see all of the budget information. A lot of them will be blank. I didn't put any salary. I didn't put any fringe. I got to scroll all the way down to other. And you can see I put in other, 420,000, and I explained it here in the narrative. There's my total, the budget summary, the objectives and tasks, healthcare services, I couldn't change that, that's what was written for me, my task, and my performance measure. Fulfill the obligation within the 3-year period. And the name of it was Fulfill Obligation. Now, uploads, unfortunately, it doesn't let you click on them. It says, yes, there is an upload here, but it doesn't say what you did. But again, you should have or could have, in your pre-submission uploads, clicked on View File to individually double-check each one. All right, so that was print application, just giving me the ability to look at it before I submit it. Now I'm going to do one thing here, and I'm going to make an error. Let's say in my program-specific questions, I'm going to go and forget to answer 3B again. So I'll hit Save. Let's pretend I don't notice the error, and I'll go back to kind of, let's say, the home page menu. So I'm going to submit it. If I go to Status Changes and Application Submitted, it says, wait a minute, you can't. You've got an error here. And I can click back on program-specific questions and take care of that problem. I could have also gone to Management Tools, check for errors, and it would have given me the same problem. So I say, oh yeah, I forgot to do that one, number 3B. Let's go and take care of that. And hit yes, and I'll hit Save. And now I'm good to go. I can do status changes and apply the status of application submitted. It asks you to verify that you are who you say you are. You're allowed to submit on behalf of your organization. You didn't give your password to anybody else. And I click on I agree. And you let it process. Could take 20 seconds, 30 seconds, something like that. Let this spin up here and process. And it's creating your application and submitting it as we speak. All right, so it's done. How do I know that it's been submitted? Well, a couple things. Number one, I'll get an email in a matter of seconds that says, congratulations, you submitted your application. Number two, it's now in the status of assignment of reviewers. And if you remember before, it was in the status of application in process. So I've sent it to the State Department of Health, and now they're going to assign reviewers to it. And then finally, it's no longer a task for me. If I go home, remember I had 4 tasks before, I only have 3 now. None of them are the one we just did. But certainly I can go back to applications, search for it, find it, and see that it's in that status of assignment of reviewers, and even look at it again if I wanted to. You can't make any changes now because you've submitted it, but you can look at it, and again, in a matter of minutes, this application version's PDF will be created and allow you to look at